I'm Susie Meter. I'm the cardiovascular nurse practitioner. My role is to follow patients from the time they enter the hospital until their full recovery, usually about 2 months after the operation. I see you in the hospital on a regular basis. I follow those patients who go to skilled nursing facilities. I see patients in the office, and I'm available to answer your questions both in the hospital and when you go home. Please feel comfortable to stop me at any time to ask questions, to share your concerns.
I was very concerned on the ability that I'd have and how long it would take to recuperate and feel comfortable.
I was apprehensive, not knowing what to expect exactly.
I felt confident that this was going to work for me.
Your heart surgery marks the beginning of a new life for you, one that will eventually allow you to be healthier and more active than before.
Good afternoon. May I help you?
Hi, I'm Mr. Richmond, and I'm here for surgery.
Good morning. Ron Richmond? Yes. How do you do? I'm Beth, one of the nurses here. Mrs. Richmond?
Yes.
Right this way, please. This is our same-day surgery area. I'm going to bring you right over to this corner, and we'll talk with you a little bit, make sure everything's ready for surgery. Any valuables, rings, and whatnot will be given to family, glasses, and also denture material if you have any. We need to remove all of that and give it to family, and we'll put your clothing that you're wearing right now in this bag. Okay? Any questions?
Preparation for your surgery may take 1 to 2 hours.
Really, the only thing you're going to experience with this procedure is they'll start an IV in your hand, and once they do that, that's the last you'll remember. There's no pain associated with anything else. Everything else is done when you're put to sleep. You don't smell anything funny. Everything is given through the vein.
Not far from the operating room, members of your family can wait. The surgery can take 4 to 6 hours. Soon after your surgery, your cardiac surgeon will speak to your family personally.
Everything was just fine today. No problems whatsoever. They're just finishing up now, and he'll be rolling out from the operating room back down to the ICU.
And when can we see him?
Well, it'll be probably about an hour or so with the nurses just getting him settled in the ICU, putting on monitors and what have you, and then you can go down and see him. But most importantly, I want you to know that everything went just fine.
You'll begin your recovery in the cardiac surgery intensive care unit. You'll have a tube in your throat for a few hours. Then a mask with oxygen will be used.
In an ICU, you have very highly skilled nurses looking at every little thing that's going on with their bodies. It's a little bit overwhelming. There's lights coming from you at all directions. There's people rushing around. You just hear overhead pages. You hear everything. They're there to rest. They can't have a lot of people around them except for the medical staff.
Your family can follow your progress easily by choosing one member to stay in touch with the critical care nurses.
You can call at any point. As a matter of fact, we encourage you to call. It's very important to keep in contact with your loved ones during this kind of surgery.
Listen to your heart real quick.
Most patients feel very tired the first day after surgery.
Nice and easy.
Within a day, you'll be up and sitting in a chair.
Well, I was really surprised that I could get up and move around.
We try to get a patient up and out of bed as soon as possible because this aids in their recovery. They become stronger faster, they breathe, they cough more quickly and more efficiently so that it can prevent any post-op complications.
One more time. Excellent job. You're going to be working on your incentive spirometer, you're going to be coughing and deep breathing. That's the best thing you can do for yourself to help you get out of the hospital, okay?
You breathe easy.
You breathe it up.
While your time in the intensive care unit is short, it's the first major step in your recovery from heart surgery.